Hi, everyone. My name is Jason Grillo. I am helping out with the conference with Nico Johnson. The previous session with Julia Ham is running a little bit long, so Nico will be taking over once that session is concluded. So it's a pleasure to have everyone here today. The guest for the session is Dr. Laura Stachel from the group We Care Solar. Uh, Dr. Stachel is an inspiring story highlighting decades of work with We Care Solar, supplying renewable power to critical needs in remote villages of Africa and beyond. She's the executive director, co-founder of We Care Solar, is also a former obstetrician-gynecologist with 14 years of clinical experience. She's also the was the associate director of emergency obstetric research in West Africa for the Bixby Center for Population Health and Sustainability. She was the principal investigator on MacArthur Foundation project on We Care Solar Suitcase usage in Nigeria and Uganda, and was co-investigator for a collaborative population council study that assessed the standard of maternity care in Nigerian state hospitals. As mentioned before, she's the co-founder of the nonprofit organization We Care Solar. She and her husband, Hal Aronson, launched the organization to provide sustainable lighting systems to hospitals and clinics in developing countries where mortality rates due to childbirth were high. So with that, I will turn the mic over to Dr. Stachel to continue.
Thank you so much, Jason. Can you hear me?
I can hear you, yes.
Okay, great. Well, it's a real pleasure to be here, and it's really an honor to be able to share the experiences that we've had through about 10 years of working in the developing world, trying to bring energy solutions to very remote communities. It's quite a journey. I'm actually a physician by training, so you might say, why am I on an energy program right now? But I think one of the things that I really learned from having tried to do work on addressing maternal mortality in developing countries is that as a healthcare provider, you need to have a lot of hats. And one of those hats is that you need to have electricity and understand electricity in order to do your job. So I actually tried working in Nigeria in a hospital that was serving a city of about 1.5 million people. And in that state hospital, they had about 150 maternal deaths every single month. They had 150 deliveries every month and about 3 to 8 maternal deaths every month. And that was something that was unheard of from my own experience as a physician in the United States. I had always assumed that childbirth was a very happy event, not one that was really linked to mortality, certainly not to the degree I was seeing in Africa. So that experience really led me on a journey, and I'll be sharing some of that journey in just a moment. What I'd like to do now is share some slides. So the name of the organization that my husband and I started is called We Care Solar. It started out as an acronym. The We Care stands for Women's Emergency Communication and Reliable Electricity. And it was really born out of the experience that I had in that Nigerian hospital, where I got to see what it was like for health workers to struggle to provide services when they did not have reliable electricity or emergency communication. If you look worldwide, there are probably hundreds of thousands of health centers that don't have reliable electricity. This is a picture of the maternity ward in that same hospital that I was just describing to you. And so if you could turn lights on in this room, you would actually see more than a dozen patients, their newborn infants, family members in a room. But at night, this was literally the only thing that could be seen in that maternity ward. That was the case for the delivery room, where there wasn't electricity. In fact, this hospital, even though it was connected to grid power and it had a generator, it was still without electricity for 12 hours every single day. And so without electricity, health workers were forced to either compromise the kind of procedures they were doing, or delay procedures, or cancel procedures, including sending people away from the hospital at night. I was there one evening when a woman was banging on the door with her family, and she was literally in a pool of blood, and she probably was in labor so long that her uterus had ruptured and she was bleeding to death. But because this was the only light in the hospital, it meant that the emergency procedures, including a laparotomy and a C-section to take out the baby couldn't be done. And the only thing the nurses could do was send her away into the darkness. So if you look at sub-Saharan Africa, the World Health Organization actually studied the electrification of health facilities in 8 sub-Saharan countries. And what they found was that 72% of the health centers did not have reliable electricity. That's about 3 out of 4. 1 in 4 had no electricity at all. So that meant there wasn't even something like grid electricity that might be subject to load shedding because there are too many customers for the amount of electricity that's available. That literally means health centers that are completely in the dark. And in those situations, health workers might be relying on a kerosene lantern like you see here. They also could be relying on candles. And more recently, what we see in many of the countries we serve, they use cell phones. And so they hold up their cell phone with a little bit of light. And to do deliveries, you actually need to have 2 hands free. So in those situations, they put the cell phone in their mouth so they can keep their hands free to do procedures, but that means they can no longer communicate with patients. We think that this is part of the reason that so many women are dying in childbirth. If you look globally, about 300,000 mothers lose their lives every year from complications of pregnancy and childbirth. 1 million newborns don't survive the first day of birth, again, due to complications of childbirth as well. And so this is really an important issue that needs to be addressed. If you want to put these in very graphic terms, 300,000 mothers would be like one 747 jet filled with pregnant women crashing to the ground every single day. That's how many people are being lost from something that we consider to be very joyous in most countries around the world. So I began working in the hospital as I described, and at the time I realized that I could not function very well if I didn't have a source of electricity. And my husband, named Hal Aronson, he was creating solar electric systems as part of a school education program he was doing in California. And he designed a solar electric system for the hospital. And what we did was we targeted the areas of the hospital that we thought were most relevant for maternal survival. So we brought in solar electricity for the operating theater, for the maternity ward, for the labor room. And we also brought in solar power for a blood bank refrigerator so that when women were hemorrhaging, which is one of the highest causes of maternal mortality, they'd be able to immediately get blood transfusions. And what we saw over the next year was that there was a 70% drop in maternal mortality. The other thing we saw was that the hospital no longer needed to turn away women at night, so that more women were actually being admitted. There was about a 16% increase in admissions. Now, at that time, there was no We Care Solar, there was no organization, there was just the realization that solar electricity, and this was like 2008, could have a profound impact on the ability of health providers to conduct life-saving procedures. Well, what began to happen was that the people that I was seeing in the hospital began introducing me to clinics that were close to the hospital. And at that time, I really didn't understand what a profound problem energy poverty was in healthcare. But as I met with these other clinicians, like this is a small clinic called Tutanwada that was near the big hospital, they said to me, "Why are you only helping the big hospital? We are in the dark as well." And for that hospital level program I just described, my husband Hal had created a small prototype solar electric system that I could tuck in my suitcase and bring to my colleagues to really show what solar electricity was about as we prepared for the larger hospital level system. When I began to see that there were so many smaller clinics that needed help, we started thinking that maybe we could create suitcase-sized systems that I could literally pack with my luggage each time I returned to Nigeria to be able to support health workers in these smaller clinics. And so we said, what are the most essential needs for these health services for the maternal and newborn health care? And we said, well, light is super important. So we wanted a very good quality light. We wanted the ability for health workers to have emergency communication so they could call together teams when they were needed for conducting cesarean sections or call for an ambulance if it was a smaller health center. And also power to support other medical devices. And what you're seeing in this picture is one of our early homespun solar suitcases, as we called them. Again, at that time, there wasn't really an organization. This was a group of volunteers. We would meet in our backyard and create an assembly line where people would put together these kits that were basically taking together off-the-shelf parts, things like charge controllers and a breaker box and small batteries and panels that could fit in my suitcase. And each time I'd return to Nigeria, I would bring a few of these there. Well, at a certain point, I spoke to Nicholas Kristof, who writes for the New York Times, and described some of the work that we were doing and appreciated the work he had been doing in Africa regarding healthcare. And unbeknownst to me, he wrote about us in the New York Times. Well, the next day, we got requests from around the world, and we realized that we absolutely needed something that could scale because this problem was bigger than the one part of northern Nigeria in which I was working. So over time, we ended up fabricating what is called the We Care Solar Suitcase. And this is a medical quality solar electric system that is rugged, that is reliable, that it's safe, that has everything needed, but that fits within this case, which both works as a mobile unit, but the case itself can be anchored to a wall for permanent installations, and it could be expanded to meet different needs. And most important, by using a renewable source of energy, the sun, this was something that was sustainable. So if you look at this picture now, you're seeing that through about 2 early years of field testing and then a lot of other feedback that we got from healthcare workers in the subsequent years, the solar suitcase has really developed. The lights that you see there are custom made by our team. They can provide 70,000 hours of light, so you don't have to replace light bulbs month after month. There's a fetal Doppler that's in the left-hand part of the screen that allows health workers to listen to a baby's heartbeat during labor and detect which babies might be at risk for distress and might need cesarean sections. We have rechargeable headlamps so that there can be a direct beam of light wherever it's needed. And in the case of gynecologic care, sometimes that light needs to be shined into private places where it's really hard to have an overhead light do the job. We also have charging for cell phones, for tablets, for computers if needed. And we also include rechargeable AA batteries, which help to keep the fetal Doppler powered even over the next months and years in communities that may not have access to things like stores for batteries. What's the impact of having a suitcase? And in this photo, you can actually see what it looks like when a suitcase is on the wall. Well, it provides continuous lighting through the night. So there's no longer those long power outages that were so tragic in my experience in Nigeria. We're seeing that when health workers have this source of light, they can really improve the quality of care. It also allows health workers to be connected. So if they need to call for help for an ambulance, they always have a source of power for their cell phones. And I've already mentioned that it includes a fetal Doppler, which allows for fetal monitoring. In health centers that have solar suitcases, we see almost immediately an increase in the numbers of women who come to health centers for care. Many of these women are impoverished. They may actually attempt to deliver at home. And the fact that there's either no light in the health center or the fact that health centers without electricity are going to ask mothers to bring kerosene or ask them to bring candles means that many of them may never come to the health center. So once the community is aware that the health center is well equipped with light, it really increases utilization of the facility. The other thing we see is a real transformation for health workers. They no longer are fearful of coming to work in a darkened health center, and they tell us they have increased confidence and increased morale, and there's more of a likelihood that they'll be staying to work in that health center for years to come. We have done more formal evaluations, and the quantitative research that we've done has shown that when the solar suitcase is incorporated into a holistic program for maternal health care, where there's education for health workers, where there's transportation to health centers, and there's solar suitcases for light and electricity, there can be decreases of maternal mortality as high as 40 to 55%. And these are from studies that have been done in Uganda with AMREF, which is an international NGO, and studies in Tanzania and Nigeria with the international NGO called Pathfinder. Similarly, we've seen decreases in newborn mortality of rates between 40 and 73%, and we see an increase in the utilization of health facilities with studies showing up to 80% increase in nighttime deliveries. So we know this technology works. Even though it's a very small and compact system, it really makes a big difference. In addition to the maternal health care applications, we've also used solar suitcases in a number of natural disasters and epidemics, such as Ebola. That's where this picture is taken here. That was from Sierra Leone during the Ebola epidemic. And the fact that the system we have is pre-wired, simple, easy to set up, effective, and immediately operational makes it very attractive in emergency situations. After the typhoon in the Philippines, we sent hundreds of solar suitcases to damaged health centers, to health workers that were working temporarily in tents. And over time, those solar suitcases have been reallocated to permanent health centers where they can be anchored on the wall and provide extra resiliency to health centers that are subject to ongoing climate changes. Similarly, in Nepal, after the earthquake, we also sent out solar suitcases, and many of these were used in temporary tent situations that were used for both patients in labor and patients having deliveries. And so the fact that these were portable and mobile were very, very helpful. To date, we have reached more than 5,100 health facilities in more than 20 countries, and many of them are shown here. We also have an intense training program, both to train people to do installations and to also allow health workers to understand how to use and maintain this technology. And to date, we've reached more than 20,000 health workers through our programs. And we estimate that more than 5 million mothers and babies have been served in health centers that have solar suitcases. And you'll see that there's a difference in shading on this map, and that's because 4 of the countries on the map, Sierra Leone, Liberia, Uganda, and Zimbabwe, are part of our Light Every Birth initiative, which are national initiatives to make sure every health center in those countries have reliable light and power for safe deliveries. And we'll talk about that a bit more. But first, I wanted to mention that electricity alone and technology alone is not enough. We really need to think about how people get trained to do installations, to maintain these, and to service these for years to come. And it's really important to think about the entire ecosystem of support. Just bringing in a solar electric system and walking away is really fraught with peril. And if any of you have worked in developing countries, you will see a lot of broken solar electric systems there from well-meaning NGOs and donors who thought about the capital costs and the capital implications of bringing solar to facilities, but really haven't considered the sustainability aspects. So very early on, we wanted to build local capacity, and we created a certified training program where we teach technicians how to do high quality installations, how to troubleshoot when there's problems, and how to take care of solar suitcases for years to come. We also have increased supply chains by creating partners that can bring any parts that might be needed over time. We provide spare parts at the beginning, we provide tools, we provide the hardware for installations, and then we also plan for when batteries need to be replaced. For as all of you know, solar electric systems have batteries and they will need to be replaced over time. We currently use a lithium ferrous phosphate battery that requires replacement about once every 5 years. So in addition to having certified trainers, we work with ministries of health and their district health technician. And this picture is from Malawi, and it's actually showing more than 20 technicians from around the country who came to our trainings. And these technicians are ordinarily doing things like working with the government to ensure that vaccine refrigerators, what's called the cold chain, is working well. So they're very bright. They know about sort of some basics of electricity. And with a little bit of training, they can really help us increase our workforce and our brigade of people that can take care of systems for years to come. The other thing, oh, excuse me. I guess I had a Zoom call going there as well. The other thing that we've done is we've really tried to promote women as some of the lead instructors in our program. We created a solar ambassador program for women in 2012, where we brought about 14 women from around the world together to teach them about healthcare and about energy. And many of these women are leading those training programs for the district health technicians and for others. We really think that as much as women are benefiting from solar suitcases, we think that they should be the change makers and the leaders as well. So gender equity is really also a foundational part of our programs. And finally, we also have seen that for many of the people we work with, becoming a solar installer with Solar Suitcase has really given them a livelihood. And so there's a number of groups where solar entrepreneurship has really been boosted by our programs. So what I'm going to mention now is an initiative we started a couple of years ago that's called Light Every Birth. And Light Every Birth is an initiative which really is based on three fundamental beliefs. One, that every woman has the right to a safe delivery. Two, that every health center is entitled to clean, reliable electricity. And thirdly, that we believe that solar power is really offering an immediate and sustainable solution to this. So the idea is that women should have safe deliveries and that clean energy should be part of the solution is really core to the principles. And we have worked with ministries of health to establish memorandums of understanding and get their commitment that every health center in their own country will have reliable electricity. And to start with, we selected countries that had very high rates of maternal mortality and low rates of electrification. Liberia was our first Light Every Birth country, and I'm very thrilled to say that last year we were able to reach all 430 health centers that were assessed as being in need of light for safe deliveries. And we're doing the same in additional countries, as I mentioned on the map slide earlier. To scale up Light Every Birth, we really see that there's four components. One is that we're trying to reach every health center in a whole country. We call that whole country saturation. And for a small nonprofit based in California, it's a pretty ambitious goal. So we couldn't do that without a lot of partners. And we work both with ministries of health and with NGO and UN partners on the ground. I already mentioned a couple of those, AMRETH and Pathfinder. There's others like UNICEF, UNFPA, World Health Organization, and smaller NGOs that are part of our whole coalition of partners. We also believe it's important to build an evidence base. I mentioned a couple of the studies that we've done, and there's also been a randomized control trial that was done by Harvard earlier, and that will be published later this year. We also believe that advocacy is really important for scaling up, and we know that solar suitcases are just one of a number of solutions that are needed for healthcare. So if any of you on this call are involved in doing solar electricity, think about how you can adapt the work that you do to really prioritize health facilities, because we really cannot achieve universal healthcare access unless healthcare workers themselves have the power to save lives. For Light Every Birth, we're initially aiming to have complete saturation in 5 countries. We believe there will be more than 8,300 health centers served by this program, and there will be about 16 million mothers and babies as beneficiaries over the first 5 years of the program alone. With a simple battery change in 5 years, there'll be another 5 years of service of our solar suitcases. And we're on the way towards our $29 million fundraising goal. We have about $7 million committed to date. Well, I'm sure COVID-19 is on many of your minds, and it certainly has been for us, particularly in healthcare, where it's so important to have healthcare workers empowered to save lives. So we have been called upon by a number of our country partners to bring in solar suitcases. We've already talked about the way it helps maternal health care, but many of these same facilities are providing primary care. And what they're doing is trying to screen patients for infections. They're trying to isolate them in part of the health centers, and they need to have light and power for all of those things. And so we are trying to fundraise right now to get solar suitcases to these health centers. The fact that it's prepackaged, immediately operational, and can be used both for COVID-19 care issues as well as long-term primary healthcare issues make it a very good, reliable, and sustainable solution to these issues. We also are learning that many of the countries in which we work, they don't have the ability for people in their own homes to isolate and do some of the social distancing that we're familiar with in the United States and other countries, because family members may share a very small amount of space for multiple people, and there's not the ability to go to your own room or have your own bathroom. So In those situations, the countries are setting up isolation centers. They're taking things like schools and community centers and converting them into holding centers for patients who are at high risk of having COVID-19. So these are the people that don't yet need hospitalization, but that should not be at home with family members. And solar suitcases have been requested as well for those centers as something that will provide light. We're also going to be including infrared thermometers with rechargeable batteries that can be powered off of the solar suitcase so that health workers can immediately assess patients for whether they have a fever and which patients may be needing to go to the hospital. So that's a little bit of how we're responding to COVID-19. We also know that health departments have a really tough balance. Everybody wants to be responding to COVID-19, of course, because of the pandemic. But there's a lot of gains that have been made in maternal health center over the last decades, and we don't want so many resources to go to COVID-19 at the expense of some of those other important parts of healthcare. So I think we need to always remember, how do we balance the general healthcare needs with the needs in terms of this pandemic? Well, that's the main points that I was going to make today right now, and I'm really happy to be answering questions and really talk about any other issues that have come up as you've listened to this presentation.
Fantastic. Hi, Dr. Laura.
Hello.
So good to see you. I apologize that I wasn't able to jump in right at the beginning, but man, what a phenomenal story. Of course, I've been able to see the work that you've done and to have long conversations with you about the work that you've done, but we're really thrilled to be able to share it with our Suncast audience. And just what an inspiration you are, and the work that you guys are doing, and truly meaningful work in the world. I love the analogy that you used around the number of women needlessly perishing due to lack of resources that we consider common resources that we take for granted in many cases. Well, Dr. Laura, I wanted to take a moment so we've got about 15 minutes here, and our team is going to be sharing with us any questions that come through. So if you're watching and you have a question for Dr. Laura Stachel, I would encourage you to put it in the Q&A if you're on Crowdcast, and we'll get that over to Dr. Laura here in the studio. And if you're on LinkedIn or Twitter or Facebook, thank you for watching. Please put your comments as well into the feed, and we'll have folks port those over to us in our studio so that we can address them. But Dr. Laura, I had a handful of thoughts that I wanted to sort of explore with you. And the first is, you obviously started your career in the medical field and have transitioned into effectively entrepreneurship. I would love to hear more about why you call yourself the reluctant innovator. It'd be good to hear the story of how and why you decided to leave the medical field to pursue this journey that's taken you about 12 years.
Yeah, so it was kind of interesting. I think the reason that I call myself a reluctant innovator is that there was no master plan. It wasn't like I sat down one day and said, gee, I'd like to invent a technology and do some social good. It really wasn't like that at all. I had been working as a physician, and I was doing obstetric deliveries, and it was actually during a C-section one night that I felt a searing pain go down my back, and soon learned that I had degenerating discs in my neck, and that the discs in my neck were pressing on the nerves to my arm, and it really inhibited my ability to do clinical care. I couldn't do surgeries. I couldn't do a lot of the procedures. And I had always had an interest in public health care. And after about a year of doing physical rehabilitation, I actually entered in my 40s a program to study public health at UC Berkeley. And I had never realized that maternal mortality was such a huge issue. And I was invited at one point to go to Nigeria just to provide some expertise on how to study maternal health care. And it was supposed to just be a 2-week visit. And I mentioned this right at the very beginning, so I'm not sure if you heard that part, Nico. But what was supposed to be just a 2-week consultation visit literally changed my life. So in this country here, we measure maternal death as how many women die per 100,000 live births. And at that time, there was about 14 women in the United States dying for every 100,000 births. 14 too many. But compare that to what I found in northern Nigeria, where there were 3,000 women dying for every 100,000 live births. And everyone I met knew someone who had died in labor. And as much as I wanted to help people in the United States, I said, oh my God, these are my sisters in other countries. Just because of where they happen to be born, they're throwing, they're like turning the roulette wheel every single time they go into labor. In fact, there's another statistic that's called the lifetime risk of dying in childbirth. And those young women, when they face their reproductive years, when I was in Nigeria, had a 1 in 13 chance of dying from complications of pregnancy and childbirth. So this was something that was so huge to me that I felt like I wanted to be involved and be helpful. And it was while I was doing observations for the research I was doing in that hospital, and I personally was doing a C-section when the lights went out. And I personally was in a room with someone with had high blood pressure, whose body was basically having seizures, and there was no light whatsoever except for my own flashlight. So I think because I got to experience the problem as a provider, sort of being involved, once I saw what was there, I couldn't turn my back on it. And I said, these women are dying in silence, and maybe I can be a voice for them. So really what came about first was just the recognition of a problem, and then a passion to do something about it. But I didn't have a solution. I just knew I wanted to do something. My husband is sort of the technology geek that was like, we could do solar, come home, I'll help you think of something. So it was actually a partnership. It was the fact that he had something that he thought could be a tool to help. And at first it was just to help one place. It wasn't like I didn't know this was a global problem. I just wanted to help the hospital. So when I went back, I didn't have to work in the dark. And then it was by providing that one bit of help that other people then came to us and said, why aren't you helping us? And so what I like to recommend to people is, think about what the problems are that you feel most passionate about, because all of this work is super hard. You're not going to keep doing it unless you feel really committed emotionally as well as intellectually. And then 2, you don't have to have the big picture answered from the beginning. You just need to open the first door. So for me, opening that door was, I'm going to help one hospital. It was only when I entered that room that I could see other doors like, oh my gosh, there's other health centers in need. And I had a choice. I could have said, well, that's nice. There's others in need, and I hope someone takes care of it one day. But I didn't. We said, well, what could we do to open that door? And that was just about this little area in northern Nigeria. And then after we learned it was a problem worldwide, so Nicholas Kristof wrote about this in the newspaper. Literally the next day, we got requests from places as well as donations. And we're like, hey, people care about this. And this is a big problem. In fact, we named ourselves We Care, both because of what it meant as far as electricity. I mentioned the acronym, but also to say we do care. Like, if you knew about this problem, wouldn't you care? And indeed, people did care. People have been showing up for 10 years supporting these programs. So reluctant just means this was not intentional. And honestly, it has been so hard to start an organization and all of the challenges of trying to manage programs on the other side of the world that I think if you had laid out everything that would come, it probably would have been too overwhelming. And I probably would have said, that's not me. I don't have the capacity to do all of these things. If someone said to me, I'd be doing it, I don't think I knew that I could have done it. So I just recommend taking step by step and sort of letting the process help bring you to a portal, and then decide, can I go a little bit outside of my comfort zone to do what's required of me for this next step?
Yeah, I think that is really beautiful. The idea of starting with the problem that you care about and not getting caught up in the idea that what you're doing can save the world, right? It's one foot in front of the other. And next thing you know it, 12 years later, you've changed countless lives and you've inspired countless others. I was inspired by the Women Ambassadors program, and I'd love to know if you've had any success stories that you would share with us as we round out the final minutes that we have around the Women's Ambassadors program and as these people are being trained to deploy these systems and provide service to them.
Well, as we all know, women are half of the world, and they need to be half of the problem solvers. And I think if we don't model this for people, they don't really consider that, particularly in a lot of the countries in which we work, where they're very, very much traditionally like having men in technician roles. And actually women are fantastic at it and really care about it. Part of why we started with bringing in women, well, there's a couple of funny reasons. We are doing installations in one of the most private places in the world, labor rooms. women are not necessarily covered very well. They're in the middle of having their birth. Now you're asking an installation crew to come in and do an installation, and you can't always predict when you're going to come and who's in labor. So for one, we thought it would be much more comfortable if we have women installers there. Secondly, a lot of the people who deliver babies are women. And I have to tell you that when I started this work, I knew nothing about solar, and it was kind of intimidating. To be honest, the reason this first solar suitcase was made is I told my husband, you need to make something pre-wired and easy because I'm never going to remember the things you're telling me about solar. I wanted it to be easy enough for a doctor to use, not an engineer. And so I think by having women as teachers and trainers, like I'll tell people when I go into teaching, look, if I could do this, so can you. We both know how to deliver babies. If I could figure out how to turn on these switches and take care of this thing, so can you. So I think it's giving women a sense of possibility. And some of those first solar ambassadors, we thought that every year we'd be having a new cohort. Those women have stayed with us for 10 years now. One of them moved to Uganda, and now we're going to be building a brigade of Africa-based women installers. I want to say one more thing, if I could, Nico, just as you were just mentioning the innovation. One of the things that I don't think is talked about enough is the issue of failure. There have been a lot of failures along the way. There's failures in design of technology, in design of programs, in how do you work with other partners on the other side of the world. And so I want people listening to know that failing is not a reason to give up. It's actually part of the whole process of becoming an innovator. So, I can't say I knew what I was doing, but I was very much willing to learn from mistakes. And I was always willing to ask for help. And so I surrounded myself by people much brighter than my own, people who knew about business and finance and international development and engineering. And we have now a wonderful team, both here in the States and in Africa, of people that really work together as a really fantastic family of problem solvers. So I don't think not knowing all the answers is a reason to give up or failing.
What a phenomenal story. And as I said before, such an inspiration. I really, I didn't anticipate, given that I know your story and the way that you've grown and struggled and really persevered and brought this product to market to save lives. I'm touched by the number of real world life lessons that you're able to share with those of us who are thinking, how can we help? How can we think about innovation? What does entrepreneurship look like? Even as you have put it, if you are in a position of being a reluctant innovator. Well, Dr. Stachel is an inspiring and influential change maker, someone who, without a doubt, is elevating not only the vibration of our planet, but the possibility and the opportunity for those who've been isolated and marginalized. So we're grateful to be able to highlight on a world stage the work that you are doing. We're so happy to have you join us here at the Suncast Clean Energy Summit. I think that I have a bunch of follow-up questions, and I want to give them their due course. So I would encourage folks that are watching this and want to learn more or hear more. All of the follow-up questions that I've written down, I'm going to include in a forthcoming episode with Dr. Stachel on Suncast, where we're going to go deeper into her story and address some of those questions. So if you have those questions that you'd like us to include in the episode, please drop them in the comments. We will be sure to capture those and include them in the forthcoming recording that Dr. Stachel and I have already established. If you are watching this and you're going to jump over to the next session, I'll just highlight the fact that something we're really proud of for the summit, we are aiming for today, and we're going to for sure achieve it, gender equity on the stage, so on the panel, right? So we've got 6, with the exception of one product showcase, we've got 6 male and 6 female participants. And the next panel is all about diversity and inclusion. So I'd encourage you watching to go over and check that out. If you're not yet registered for the summit, please jump over to suncastsummit.com and register so we can keep you up to date. And I want to say just one more time, Dr. Stachel, thank you so much for the time that you've given us and the inspiration that you've allowed us to feel on the 50th anniversary of Earth Day.
Thank you. It's been such an honor to be here. Thanks for what you do, Nico.
Absolutely. Well, one final thank you to SunGrow, and all of our other sponsors who have come alongside us to make this possible for you all to watch free of charge. Thank you to those who have contributed. I'll just throw up a little splash page here. So you can see we're proud to have so many partners with us helping make this all possible for you. Again, once more, thanks to SunGrow as our main sponsor, and we look forward to bringing you more content like this in the coming days and months as we are all sheltered at home and as we get restless and not being able to see each other and attend live events. For now, I'm going to jump over into the next stream. I would encourage you to hop over as well if you've already registered for it. If not, check out suncastsummit.com. Register. You don't want to miss this one. Glinda is going to dive into equity and inclusion with some of my favorite entrepreneur female leaders in the space. Ciao for now.